Thank you everyone for joining today as we discuss the Laboratory Identified Events module for long-term care facilities. Part 2, we will discuss an overview of the multi-drug resistant organisms. My name is Hannah Byers and I am an infection preventionist contractor with the CDC within the Division of Healthcare Quality Promotion and Surveillance branch. Today, we will discuss the MDRO LabID event definitions and protocols, define the required monthly summary data, how to manually enter the MDRO LabID event data and monthly summaries into NHSN, and explain the importance of and steps for resolving data quality alerts. Now we will discuss multi-drug resistant organisms, also known as MDROs, key terms and definitions. Unlike CDI, users have the option to elect to follow one or all of the organisms shown below. As a reminder, please submit all MDRO LabID events for all specimen sources to NHSN. Now we'll discuss a few common terms and definitions used in the LabID event module. MDRO positive isolate is any specimen obtained for a clinical decision-making testing positive for an MDRO. Note, this excludes any positive isolates collected for active surveillance testing. And then an MDRO LabID event is MDRO positive isolate from any specimen source collected while the resident is under the care of the reporting long-term care facility, which includes residents physically housed or cared for in the reporting long-term care facility, as well as residents being cared for during a brief outpatient visit, in which the resident returns to the reporting facility on the day of the outpatient visit or the following calendar day. MDRO specimens that should be excluded are negative MDRO lab results, specimens collected as part of active surveillance testing, specimens collected prior to admission to the long-term care facility or during an inpatient admission in another healthcare facility. Categorizations are also defined like those as just reviewed for CDI events. The following categories are below: reported date of specimen collection, which is the event date, reported specimen source, specifically blood sources, reported date of current admission to the facility, and reported date of last transfer from acute care to your facility. Since all specimens are entered for MDRO events, NHSN will remove duplicate events when the same organism is subsequently collected from any non-blood source in the same calendar month, and the same organism is collected from a second blood source in the subsequent 14 calendar months. As a note, while these events are not further analyzed by NHSN, a facility user may opt to review an NHSN line list to review all submitted MDRO LabID events, including duplicate and non-duplicate events. Non-duplicated MDRO LabID events are further categorized for analysis, the first being community onset. This is the date specimen collected 3 calendar days or less after the current admission to the facility. For example, day 1, 2, or 3 of admission. Long-term care facility onset is the date specimen collected more than 3 days after the current admission to the facility. For example, on or after day 4. Long-term care facility onset events are further subclassified as acute care transfer long-term care facility onset. Long-term care facility onset LabID events with a specimen collection date 4 weeks or more following the last transfer from the acute care facility, such as a hospital, long-term acute care hospital, or acute inpatient rehabilitation facility only. For example, with a resident that has a June 4th admission date, any MDRO positive LabID event of June 7th or later would be categorized as a long-term care facility onset event. Anything prior would be considered as a community onset event. Here is another example. Ms. Smith was transferred to your SNF from an acute care facility on July 1st. A urine culture was collected on July 10th that tested positive for VRE. The SNF submitted a VRE LabID event to NHSN for July 10th. First, the NHSN identified the submitted event as a non-duplicate since the application did not detect a prior VRE LabID event submitted for Ms. Smith in the month of July. Next, NHSN categorized the non-duplicate VRE LabID event as acute care transfer long-term care facility onset. Since the specimen was collected more than 3 days after her current admission date, and the submitted event indicated a transfer from an acute care facility to your SNF in the previous 4 weeks. Now we will discuss the monthly reporting plan for MDROs to participate in NHSN. Similar to CDI events, a monthly reporting plan must be in place prior to reporting into NHSN for that calendar month. Again, the monthly reporting plan informs CDC NHSN which modules a facility is following during a given month. Think of it as the facility's commitment to entering data for a chosen event for the month. This plan will inform CDC which data can be used to aggregate data analysis, such as developing a national baseline. As another reminder, plans can be modified retrospectively and can be entered for up to 1 year in advance. For adding a monthly reporting plan, users should hover over the reporting plan on the left side dashboard, select Add, and then under Add Monthly Reporting Plan, enter all information, which has a red asterisk indicating it is a required field. Below, under LabID event modules, you will then click Add a row to add which organisms that you plan to include. On the bottom left-hand side, you can see Add row to add multiple organisms. Please be reminded to save before moving on or exiting the screen in your NHSN application. Next, let's review the steps for submitting an MDRO event into the NHSN application. As previously mentioned, event forms are available on the NHSN website. One form should be used for each LabID event identified. Forms can be customized, but the NHSN protocols must be followed exactly. Every NHSN form has an accompanying table of instructions that gives detailed instructions for completing the form. Here you can find the hyperlink to the form on the bottom right-hand side of this slide. To enter a CDI or other LabID event from the home screen, users must click Event and then select Add. As you see, users also have the option to select Find events that have previously been entered into the NHSN application. One may elect to select this option to review a particular event or perhaps edit and make changes to an event that has been previously entered. Users can also review incomplete events, which will need to be addressed before data can be considered complete. For the purposes of this presentation, though, we will click Add to add a new event. Next, enter the resident information, being sure to complete every field marked with a red asterisk. Next, the Add event page will pre-populate with the facility ID. The user will need to enter the required resident information identified by the red asterisk. A resident type may be selected as either short stay or long stay. A short stay resident is defined as being in the facility for 100 or less calendar days from the date of the first admission into the facility. A long stay resident is defined as being in the facility for more than 100 calendar days from the first date of admission. Date of first admission to the facility. If the resident leaves the facility and is away for 30 or more consecutive days, the date of first admission should be updated to the date of return to the facility. Select the date of first admission using the drop-down calendar. As a note, date of current admission must occur before date of event. Example, a resident is transferred from your facility to an acute care facility on June 2nd and returns on June 5th. The current admission date would be June 5th. 1 week later, the same resident goes to the emergency department for evaluation on June 12th and returns June 13th. The date of current admission would stay as June 5th. Next, we will scroll down to the event information section. For the event type, we will select LabID event. The date of event will be the date the specimen was collected. It is important to remember that the event date and the date specimen collected cannot occur before the current admission date. Next, select the specific organism type that you are submitting the event data for. After selecting the specific organism type, the remainder of the page will populate with the relevant questions. Since MRSA was selected as the specific organism type, the next box requires the user to enter the specimen body site. For example, if the specimen is a urine culture, then you would select GU, genitourinary system. Next, you will then select the specimen source. The next box requires the user to enter the location of the resident at the time of the specimen collection. As mentioned during the CDI section, the populated resident care locations are the locations the facilities have added during the NHSN setup and should reflect all the resident care locations in the facility. By entering the resident care location, the facility is able to monitor trends in particular locations within the long-term care facility if they choose to do so. If the resident had a specimen collected in an outpatient setting and meets the previously discussed setting requirements, the selected resident care location should reflect the location of the resident immediately prior to leaving the long-term care facility to visit the outpatient setting. Next, the user is required to select from a drop-down menu the single primary service that best represents the type of care the resident is receiving on the date of the specimen was collected. The available service types are auto-populated within NHSN service types, which means they are not pre-set up by the facility. The drop-down options for resident care locations and primary service type locations will be the same regardless of the event being entered into NHSN. For the next question, enter yes if the resident has been an inpatient of an acute care facility, such as a hospital, long-term acute care hospital, or acute inpatient rehabilitation facility only, and was directly admitted to your long-term care facility in the past 4 weeks. Otherwise, select no. If yes is selected, 2 additional required questions will populate for users to answer. The date of last transfer from acute care to your facility, and was the resident on antibiotic therapy for the specific organism type at the time of transfer to your facility. Keep in mind that a resident visit to an ED visit or outpatient facility, such as a physician's office, is excluded since these outpatient visits do not represent an actual inpatient admission into the acute care facility. Just like CEI, this question will be used by NHSN application to determine if the MDRO LabID event should be categorized as acute care transfer, long-term care facility onset, if it is a long-term care facility onset event. As well as this question will be used by NHSN application to determine the burden of MDRO coming into the facility. The final question documented previous evidence of infection or colonization with this specific organism type from a previously reported LabID event in any prior month is a system auto-populated field and is based on prior month's LabID events. Yes or no will be auto-filled by the system depending on whether there is a prior LabID event entered for the same organism and the same patient in the prior months. This cannot be edited by users. As previously mentioned, the last two fields are optional and may be used for local or groups to use to customize or expand data collected by the long-term care facility. In the custom field, up to 50 fields may be customized with date, numeric, or alphanumeric information, comment section, and a place for users to add additional information about particular event. Unlike custom fields, which must be set up prior to use, comments can be added at any time the event data is being entered and is free text. Keep in mind the NHSN application does not use the data entered in custom fields or comments for any analysis functions. This screenshot provides a look at the complete MDRO LabID event. Once save is selected, the event will be assigned an event number. The user will receive a message at the top of the screen indicating the event has been created. Now we will discuss how to submit the MDRO monthly summary data into NHSN. The monthly summary data elements for participation includes resident admissions, resident days, and report no events if applicable. To begin by submitting summary data, to enter denominator data into NHSN application, select Summary Data in the Add on the left navigation bar. The NHSN assigned facility ID will be auto-entered by the system. Then select the month and year for the denominator data that you will be entering. After you select the month and year for which denominator data will be entered, the summary data page will then populate the remainder of the page to correspond with the monthly reporting plan on file for the selected month and year. Every data field with a red asterisk must be completed. Similar to CDIF, to calculate resident days for each day of the month, record the total number of residents in the facility. At the end of the month, sum the daily counts and enter the total into NHSN. When resident days are available from electronic databases, for example, ADT admission, discharge, transfer records, these sources may be used if the counts are not subsequently different from the manually collected counts. You will notice a check mark in each box under the organism or organisms the facility has included in the monthly reporting plan and is monitoring for the month. In this example, the facility has elected to include the organism MRSA and VRE for MDRO LabID events in the monthly reporting plan for the month. As a data quality check, the NHSN application requires users to verify in the application if no events were reported for that month. For LabID events, the active boxes are dependent on which organism types the facility have selected to report in their monthly reporting plan. Again, MRSA and VRE are the only two organisms selected in the monthly reporting plan. If LabID events have already been reported during the month for a specific organism, the Report No Events box will be disabled, preventing it from being checked. Otherwise, it will have a red asterisk next to the box indicating it must be completed. Here's a screenshot of complete monthly summary data. Once saved, the user will receive a pop-up at the top of the screen indicating the summary data was created successfully. Now we will cover some common alerts that may appear due to incomplete or missing data in the NHSN application. Alerts are an easy way to begin conducting data quality checks in NHSN. They are generated from monthly reporting plans, and they inform users of incomplete or missing data within the application. It is important for facilities to resolve all alerts for each month, especially prior to using the analysis function in NHSN. Users have several options for identifying and resolving the alerts. For example, a user may click on the individual alert box or click alerts from the left navigation bar. One example, a LabID event module selected for the monthly reporting plan, but no selected MDRO or CDI event was submitted for the month, and the Report No Events box was not selected on the summary reporting page for that calendar day. To resolve this alert, submit a CDI and/or MDRO event for the calendar month. If no event occurred for that month, please be sure to select Report No Events by each event type pathogen. This will then allow your monthly summary page to view as complete. Then click Save. In this example, the summary data was not completed for the month. To resolve the alert, click Add Summary, hyperlink, enter summary data under MDRO and CDI LabID event reporting, and then, as always, remember to click Save before exiting. Another example shows the summary data page is missing the required data for the calendar month. To resolve this data, click on the Summary ID hyperlink. Please be sure to then complete all missing data fields, which have a red asterisk beside them. And then finally, click Save before exiting the screen. Thank you all for attending part 2 of the LabID events MDRO overview for today. If you have any questions, please submit to nhsn@cdc.gov and include LabID reporting in the subject line to ensure your inquiry is routed to the appropriate subject matter expert in a timely manner. Thank you.